Hi, I'm Dr. Greg Oliver, and I've got a question for you to consider. I want to ask you something I ask my patients all the time. If I told you I had a treatment, and it's FDA recognized, it's been studied in tens of thousands of patients, that would clear inflammation from your body, lower your blood pressure, normalize your lipid panel, dramatically improve how your body handles blood sugar and insulin, gives you better sleep, reduces body fat, increases lean muscle, and lowers your risk of falls, and makes you statistically likely to live longer, would you take it? Of course you would. Now, what if I told you it costs nothing or close to nothing, and the main side effects are feeling stronger, sleeping better, having more energy? You're in, right? Good, because this treatment is exercise. Specifically 150 minutes a week of moderate to moderately intense physical activity, built up gradually and done consistently. And I'm going to make the case today that this might be the single most powerful health intervention available to you. More powerful than most medications, more powerful than most supplements, more powerful than most of what the health and wellness industry is currently out there trying to sell you. So let's talk numbers, because this is where it gets pretty serious. Major long-term research, including a landmark analysis published in the American Heart Association journal, that journal's called Circulation, tracking over 100,000 people over 30 years, found that adults who met the standard exercise guideline of 150 to 300 minutes per week of moderate activity had a 21% lower risk of dying from all causes, not just heart disease, all causes, which means dying of any reason. Now, some of you have heard the higher numbers, such as 40 or 45% or even 50% reductions cited in various studies. Those numbers aren't fiction. They come from different study designs, different populations, different definitions of active. But what I can tell you is even at the lower end, the consistently confirmed range, 20 to 30% death reduction, is still remarkable. That's not a rounding error. That's 1 in 5 deaths potentially delayed or prevented. And here's what makes it even more interesting. Adults who did 2 to 4 times the recommended amounts of exercises, now that would be 300 to 600 minutes a week, saw even further reductions in cardiovascular and all-cause mortality or death rates. The benefits kept growing up to a point, and then it hit a plateau. No harm going above that, just diminishing returns. So the sweet spot the research supports is somewhere between 150 and 300 minutes of moderate exercise weekly. For most of you, that's 20 to 30 minutes a day, most days of the week. So here's what I find fascinating, but yet a little frustrating, honestly. In my 20 plus years of wellness practice, people come in every week looking for answers. They want a pill. They want a shot. They want a peptide, a supplement, some device, an app, a protocol. And I understand that. We've been conditioned to believe that complex problems, especially medical ones, require complex solutions, and that real medicine comes in either a bottle or a syringe. But when you lay out what regular exercise does to the human body, the full picture, it sounds exactly like a drug you'd expect to cost $1,000 a month and have a waiting list to even get on. So let me run through it. What does exercise actually do for us? Well, first, for inflammation. Chronic low-grade inflammation underlies most of the diseases killing Americans. Heart disease, type 2 diabetes, metabolic syndrome, even some cancers. Regular aerobic exercise has been shown to reduce circulating inflammatory markers. And specifically, these include IL-6 and TNF-alpha. It is, in the most literal sense, biochemical sense, anti-inflammatory. Number 2, for blood pressure. Exercise lowers resting blood pressure, particularly in people who have high blood pressure. In many patients, a consistent exercise programs reduce the reductions of blood pressure comparable to first-line antihypertensive medication without the medication. Number 3, for lipids. Regular exercises raises HDL, our protective cholesterol. It lowers triglycerides. It shifts the LDL or bad cholesterol particles towards less dangerous profile. Your cardiologist would love those numbers. Fourthly, for blood sugar and insulin sensitivity. This one is critical for so many of my patients. Exercise makes your muscles more efficient at absorbing glucose without insulin. It improves insulin sensitivity, meaning your body doesn't have to produce as much insulin to do the same job. For people with prediabetes or early type 2 diabetes, this isn't just management, it can actually reverse the disease process. 5. For sleep. Research consistently shows that regular aerobic exercise improves sleep quality, reduces insomnia severity, and decreases the time it takes to fall asleep. Better sleep, by the way, further improves metabolic health. It's a positive feedback loop. 6. Body composition. Exercise burns fat, particularly visceral fat, that dangerous fat packed around your organs. Combined with resistance training, it also builds and preserves muscle mass, which is your metabolic engine. More muscle means a higher resting metabolic rate. Your body becomes more efficient at burning calories even when you're sitting still. 7. Fall prevention. Strength training and balance focus exercise reduce fall risk. And fall risk is one of the leading causes of serious injury and disability in adults over 65. This is about living independently, staying functional, maintaining your quality of life as you age. 8. Lastly, for lifespan itself. We already talked about the data, 20 to 30% lower risk of dying from any cause. Now, if I described a pharmaceutical with that profile, what would you expect it to cost? What would you expect the side effects might be to that pill or medication? What would you expect the FDA approval process to have looked like? Onerous. The point isn't to be glib. The point is that we genuinely undervalue exercise because it doesn't come in packaging. No one has a marketing budget for it. No sales rep is showing up at your doctor's office to promote it. It doesn't even have a brand name. But the biology doesn't care about any of that. So the question I have is, why don't people do it? I've heard every version of this conversation in my office. I don't have the time. My knees hurt. I've tried and I always quit. I hate the gym. I'm too tired. I'll start next month. And I'm not going to dismiss any of these. Some of them are legitimate obstacles to exercise. But I want to offer you a different frame of reference. Most people don't fail at exercise because they lack willpower. They fail because they start wrong, too much, too fast, with unrealistic expectations, the wrong type of activity, and no gradual progression. They hurt themselves, or they burn out, or life interrupts the streak and they just never restart. The research is actually very clear on how to build a sustainable exercise habit. If you haven't been active, 10 minutes a day is a legitimate starting point. 10 minutes of walking has measurable health benefits compared to doing nothing. And 10 minutes a day is something almost everyone can fit into their life without a major disruption. Then you build from there. Over weeks and months, you increase duration. Then you can increase intensity. Moderate activity means you're breathing a little harder. You could still hold a conversation, but it takes a bit of effort. A brisk walk, a bike ride, water aerobics, pickleball, whatever gets you moving consistently. The best exercise is the one you actually do consistently over time. In our 5-factor approach to medical weight loss, exercise is factor 2, and it earns that position because it doesn't just burn calories. Exercise amplifies every other factor in our 5-factor framework. It makes your nutrition work better by improving insulin sensitivity and metabolic efficiency. It supports your hormone optimization because physical activity influences our testosterone, estrogen, cortisol, and growth hormone. It reduces the psychological burden of behavior change because regular movement has documented effects on mood, anxiety, and cognitive function. And it enhances whatever metabolic interventions we're using, including the newer GLP-1 medications, by preserving lean muscle mass during weight loss. Exercise isn't an add-on, it's infrastructure support and building for our body. And the beautiful thing about building this infrastructure is that once it's built, it pays dividends continuously, even for the rest of your life. I started this video by asking you if you'd take a treatment that improved all of this: inflammation, blood pressure, lipids, blood sugar, sleep, body composition, and even your lifespan. And I think you said yes. So I'm asking you to make the same decision now, with the same information. Not because it's easy, not because it's glamorous, but because the evidence is overwhelming and the cost in dollars is as close to zero as medicine ever gets. 150 minutes a week, build up over time, moderate intensity, and consistent. If you're a patient of mine, we're going to have this talk about it. We're going to figure out what movement looks like for your body, your joints, your schedule, and your goals. Exercise isn't prescribed the same way for everyone, and if done wrong, it can set you back. If you found this information on exercise enlightening and hopefully inspiring, please share this video with someone who you know that needs to see it and hear this message. This message doesn't belong to any brand. It belongs to anyone who wants to live better and live longer. So hit subscribe. The next video in this series will go deeper into Factor 3 topic, metabolic enhancement. This concerns what's actually happening inside your metabolism and what we can do to fix it when it's broken. I'll see you there. This is Dr. Greg Oliver. So long for now.